Coming, they're fantastic. It's 24 minutes past 8. Good morning to you, whatever you are up to. Now, the news you're waking up to this morning on the front pages is GP surgeries in England are being told to see more patients face to face as ministers unveil a £250 million winter rescue package. Here's the BBC's Warren Hayden with more.
The emergency funding is being handed to GPs so they can recruit extra locum staff with a focus on providing more same-day appointments. Social distancing rules are also expected to be relaxed so that GPs can bring more people into their buildings. It comes after mounting criticism about the fall in face-to-face appointments since the start of the pandemic. Only 58% of patients were seen face-to-face in August, the first full month following the end of restrictions. That compares with 54% in January and more than 80% before the pandemic. Patients have also complained of long waits on phone lines to book an appointment. The announcement is part of a wider joint government and NHS England plan for GP services. It's expected to promise upgrades for telephone systems, ensuring that more patients can quickly and easily speak to general practice staff, and a reduction in paperwork by allowing other staff to provide evidence for fitness to work and fit to drive checks.
In July this year, GPs across Hampshire and the Isle of Wight carried out more than 800,000 consultations. That's an average of 26,000 a day. Just over half were face-to-face, compared with nearly 80% in July 2019. Dr Mark Sanford-Wood is the GP Committee Deputy Chair for the British Medical Association.
It's really important to remember that today alone, over 1 million people will contact their GP in England and will have their problems sorted out. Over 500,000 of them will actually be seen in their practice. So it's important to get this into context, but there is no doubt that there are some practices that are struggling terribly to deliver the care that they want to deliver. GPs are incredibly upset by the way that they are being portrayed in the media. You know, we talk about the vaccination programme, and our leaders get up there and quite gaily talk about the government vaccination policy. That was actually GPs who did 70% of that. It's GPs that have been at their post right the way through this pandemic. We have been open. It's just there are not enough of us, and we need more, and the government is not supplying those numbers, and that's why people are having difficulty accessing our services. And GPs will either be angry or they'll be heartbroken, but none of them will be happy.
Since the start of the pandemic, we've had to rely more and more on internet services, everything from online shopping, Zoom meetings, even parents' evenings went online. But patients at GP surgeries in the south say they're worried about health inequalities and digital exclusion, with around a quarter of patients not able to access the NHS online services. Joining me now is Julie Saunders, Chairperson of the Cranborne and Verwood Practices patient participant groups. Julie, good morning.
Good morning.
What's the feedback that you've been getting?
If you're talking about accessibility to the GPs, in our practice, it's generally very positive. Our practice has a triage process. If a patient has an urgent medical need, they'll be offered a consultation, usually the same day. That may be initially by telephone, and if required, it'll be face-to-face. And that has been the case in our practice throughout the pandemic.
So your face-to-face, is it getting back to its normal levels yet, do you think?
As I said, the accessibility has been the same since sort of throughout the pandemic. But I have to say that more and more people expect to see a GP face to face. That is not always the case. But if somebody wants to have a face to face appointment, then they're quite able to do that.
You're very positive about your practice there. Do you have an understanding of how we can have practices performing so well in certain places and then, weeks and weeks of waits in other places? What's gone wrong at some of the other GP practices?
Well, Alan, I can only speak for our practice. I think one of the things that we do have is a very strong patient participation group, PPGs as they're known, as there's acronyms all throughout the NHS. PPGs act as the voice of the patient and work with the practice to consider the patient experience when providing their services. So I think we have a very good relationship between our patients and the practice. There's a lot of trust and confidence there. They consider the patient experience in their service delivery. So, for example, our practice, our PPG, was very much involved in helping the practice plan and deliver drive-through flu clinics. We've also worked closely with the practice on developing or relaunching their website, which is very patient-friendly. You mentioned about accessibility to online services, and
we were talking about digital exclusion there. It's very tricky, isn't it? Because you're kind of caught between a rock and a hard place. You need to be up to date. I would like things to be all digital. That suits me. And at the same time, that's very exclusive. If you haven't got a smartphone or a tablet computer or a laptop, or you're not online, then instantly you might be listening to this thinking, well, that's me out the picture.
Yeah, and absolutely, and you're talking to the converted here, because I also volunteer as a digital champion to help people to sort of develop the confidence for online services. And we did a survey recently in the practice to ask people about their awareness of online services, and there was a mixed but generally positive response to it. A lot of people didn't know what you could do online. A number of people didn't have the confidence to go online, and that's something that we'll seek to address with sort of offering more digital learning sessions to people. But one of the things we are very much aware of, particularly during the pandemic, when all of a sudden there was this massive shutdown, that people were not able to just turn up at the surgery, and they weren't able to use online services. So with the practice, the PPG developed a community information line, and that's updated regularly. It was all throughout the pandemic to keep people appraised, so that people who didn't have or didn't want to go online could have that information at the end of a phone line, and now we're using it to keep people appraised about booster shots and flu vaccines and the like. So
access to that reassurance, that's what it gives people who are not online, access to the reassurance. But it seems to me, though, that your practice that you're sort of representing, that you're affiliated to, is an example of how it could have been done. But that needs to be done right the way across the board for everyone. So there isn't this exclusivity that's happening. Julie, we'll leave it there. Julie Saunders there, the chairperson of the Cranborne and Verwood Practices Patient Participant Group, sharing their experiences and reflecting on the news today that the government's releasing an extra £250 million for GPs.